Welcome to Tooth Be Told podcast. My name is Erica and this is Brandy.
Hello, everybody.
Thank you for joining us again. And as always, this is your first time joining us. Our podcast is about helping the underserved and underprivileged, particularly people of color, with their dental health care experience.
Yes.
So, Brandy, today's episode is actually going to be a continuance of our episode we did last week about racial disparities because we went in deep. we did a deep dive, and we definitely didn't have enough time to cover the whole entire topic. So today we're going to
Yeah.
continue that.
Yeah, there were just some things that I wanted to make sure I mentioned. So I didn't want to rush through it. And the video was getting a little long. So we decided to just break it up a bit.
Yep, absolutely. So, continuing from last week, you wanted to discuss some more details.
So particularly, I just wanted to talk about the patient aspect. So I did touch a little bit on it last week, but in particular, I wanted to talk about the children first. So I took some notes. Now, these notes that I found actually, so last time we talked, I think we both had looked up information on the CDC.gov, right?
Right. Yeah.
Um, but this time I went onto the National Library of Medicine and I found an article there. And the name of the article is the Journal of Public Health and Dentistry. So if you go to Google and you look up National Library of Medicine, you should be able to find this and look up the Journal of Public Health Dentistry. So that's where this information came from.
Okay.
So Black and Hispanic children between the ages of 6 and 9, they are more likely to have untreated tooth decay or cavities on their baby teeth as well as their adult teeth, more so than white children. And I know I talked about that a little bit last time. Also for adults, so adult age, I think it was 65 to 74, they're more likely to have untreated tooth decay or cavities on their teeth. And then adults who are 45 to 74, they are more likely to have moderate to severe periodontitis or periodontal disease, which is like an advanced gum disease. So they're more likely to have it than, our white counterparts. So
what do you think? Why? Or does it say why?
So I have my own ideas, but my own ideas were
Okay.
were kind of in line with what the article said, Erica. So
Okay.
I took a couple notes. So it says, although some of these issues, like we know, any of these issues can be caused by tobacco use, poor diet, or poor home care, poor brushing, flossing, things like that. The major reason for these inequities is reduced access to quality dental care.
Yeah.
So the reason why we have reduced access and limited access is due to the fact that we don't have, like we kind of discussed last week, Erica, dental providers that look like us or have the access to those dental healthcare providers. It's limited. So, and also with the lack of dental insurance too, that's a big, huge factor. But so we have those things, but how does racism, play a role in it? So historic ongoing policies of racism have created large racial and ethnic variations in income, education, employment, and wealth. So basically what it's saying is that racism can affect our access to oral health care by acting as a social deterrent of health. So this is reduced access to dental health, by way of just having a low amount of dentists in our population ratio. So a lot of minority communities don't have minority dentists. And they also don't have white dentists because white dentists sometimes don't want to work in those poor, low income communities. Like you were kind of saying last week, Erica, when you were like, I guess it kind of where you live at has a lot to do with it.
Yeah, absolutely. I mean, it's so sad. I'm trying to think when I was introduced to, my mom was really focused on dental she still is to this day. She always says, it's the only set you got, after your baby teeth fall out, this is all you got. And,
Mm-hmm.
then if you don't take care of it, then you're running into the factors of money. And if you don't have insurance, because, it's so many different reasons. So, I mean, hopefully we're trying to do something, just me and you,
Mm-hmm.
to make those changes and to help the people that need the help so
Yeah,
they can start going to the dentist.
absolutely. Um, so I think that was one thing. And the next thing I wanted to cover quickly was about some of the financial losses. So we know, like, if you missing work because your tooth hurt, or if your child is at school, listen, and they can't focus on their schooling because their tooth hurts. I mean, that
Yeah.
is happens every single day. If your tooth hurts, you can't do nothing. You have to go figure that out, and then work and everything else will go by the wayside until that's
Yeah,
figured out.
because it messes up with your whole everything, your
Yes.
face, your head, everything.
Yep.
And
You be having
then
a
you can't
headache,
function. Yeah, you can't
can't
function.
function.
You can't
Not
function.
at
You
all.
cannot. Mm-mm.
So I wanted to. So now some of this information is from the CDC.gov, but it was saying that among working age adults, so like our age and younger, over 40% of low income Hispanic and Black adults, they have that untreated tooth decay and oral disease, and it impacts their quality of life and their productivity. So they give some examples. So example is that over 34 million school hours were lost in 2008 because of unplanned urgent dental care issues. 34 million, like in a year. That's insane to think about. Like you
Mm.
spent 34 million hours away from school because you had dental issues, like, and stuff that just came up.
You know what? When I was a kid, I wasn't allowed to miss school. My mom would be like, "You sick? You be all right. You better go to school.
And don't go to the nurse, because if the
Don't go to
nurse
the
calls you,
nurse, because I'm not coming there to
I'm
get you."
coming to get you.
They don't do that
So
today.
true.
It'd be like that's like a faux pas. Like what? I'm good. No, people don't do that.
Downplay.
Yeah.
So that's one thing, right? Now we was at
Mm,
school. Not everybody's at school, but
yeah.
it says this is a crazy statistic right here, because it says over $45 billion was lost
Mm,
in productivity in the US each year for untreated
mm,
oral disease. $45 billion. Like, that is an insane number
mm,
each year.
mm. Yeah.
Y'all
That.
got dental issues? Like, what?
Mm,
That's
oh
insane to
my
me.
goodness.
Child, listen.
You know what I was going
Some
to ask you really quick when you talking about the children, and I noticed like recently kids, they'll have decay, right? And then they'll end up going to the dentist and get like these, I don't know. We'll talk about this on next episode. The jargon, is it caps, silver caps, or like crowns on their teeth, their baby teeth?
Listen, save it for the, because we about to hit
Okay.
that. We about
Okay.
to hit
I was
it.
like, I always wonder, like, well, what is this about? Are they gonna fall out when the tooth falls out?
So I will explain that in
Okay,
the
okay,
next
okay,
episode.
okay.
So
Sorry,
just remember to ask me. Just remember to re-ask me that.
I put the cart before the horse. Okay,
That's okay. But
I
remember
will.
to ask me that, because I will answer it.
Okay.
Okay. Then again, there was another statistic. So we got the 45 billion loss, which is insanity, but 18% of all working age adults. So that's 29% of lower income adults report that the appearance of their mouth and teeth affect their ability to interview for a job.
No.
So
But
listen, it's a
well,
real thing.
I could see the appearance though. I definitely could see that
Yes.
because I've known people in my past, like where they've had, they weren't satisfied with how their teeth were looking. So that did
Right.
impact them smiling,
Mhm.
having conversations, all that kind of stuff. It affects you greatly.
So if you're going for an interview, you want to look your best, you
Um,
want to feel your best, because you got to feel confident,
yeah.
especially if you want to get that job. So 29% of low income folks, that's a big number, are not satisfied with their smile, either because
Um,
whatever they having, whatever issues. Um,
it's just so terrible.
so yes.
Mm,
Now, before we go, I do want to
mhm.
mention that for anybody who does not have dental insurance, so a lot of these issues are because folks don't have access to dental insurance. Um, you can go and have work done for free or for a nominal fee at any dental school. That's
Yup.
Temple, that's Drexel, that's any dental school in the area. There's a bunch of them.
Yep.
You
Because
can go.
you remember back in the day, my mom used to go. I think we talked about this. She used to go get a
I used
$6
to see
cleaning.
her.
Yes, that's what I think. I
See her.
said, yes.
Look,
She used to be
you
like,
can
I'm
get
getting
some
my teeth
free
cleaned.
X-rays, free cleaning. But even
Yep.
if you need other work, if you need, root canals or implants or crowns or bridges, you can go to dental schools and have them done. I know so many people who have done it. You just have to call and find out when their clinics are open. And sometimes they do charge a fee, but it's like nothing because the dental students need to do these procedures, and it's the best work you're going to get done because although you're having a student do it, the instructors are there, the doctors are there. It has to be done right. So it's the best experience you'll get. It's going to be long. Now it's not going to be like a regular dental office, honey. You're going to have to come back several, one,
Mhm.
two, two, three visits, but
Mhm.
it'll get done and get done right. And you won't have to pay like if it's something huge, like an implant or a set of dentures or something like that.
Brandy, that is great information. I'm so glad you did that. And my mom would be so proud of you, Sid,
She,
because she
she
be
knows about the
serious.
dental clinic.
I mean,
Look.
she makes sure she gonna save this money. Yeah.
Yeah, and I mean, like I said, the only downside is it's not quick. So you're gonna have to,
Yeah.
dedicate some time. But I mean, if
My
you need something
mhm.
done, you do whatever you got to do to get it done. And that means sitting for 3, 4 hours, maybe come back 2, 3 times. You
Miss
shall
school,
do
you
that.
might have to
Look,
miss school that day. Might
look
have to
at
call out of
that.
work that day.
Go get yourself a note. But
Yep.
the other thing is, your dental office. If you have a dental office and you find yourself without dental insurance, they all have their own in-house plans. The office I work at has an in-house plan where I think it's $150 a year. You get all your cleanings, you get all your X-rays, any emergency visits. You get a discount on work, like a 30% discount. Every dental office should have one of these. You can call and ask if $150 a year is nothing to get 2 cleanings a year and all the X-rays you need.
Mhm.
Or also, lastly, you can find affordable dental insurance if you just get on the Googler and you look up you look up dental insurance. You can find it from at least what I found was $9 a month, anywhere up to $85. I think that's like if you have a family or more than like a dependent. But for a single person, if you can go on any of the major dental websites, Delta, Cigna, New Jersey has a couple of them where you pay like $12 or $24 a month. So I
Mhm.
mean, that's not a bad deal just to have some kind of insurance, because if anything happens, you rather be paying monthly, that much than have a huge dental bill for something that, you need to have done that's unexpected. So,
Yeah, there's during COVID, I found out about there's another one. I think it's a New Jersey.gov marketplace that you
hmm
can get insurance is based off of your income. You just,
yeah.
upload all your information and you could do that as well.
Yep. So I just wanted to give you guys some of that information. And I think that's it for now. We probably will touch on racial disparities again and again and again because it ain't going nowhere until we can figure out a way to bridge the gap
Mhm.
for folks. We'll probably be talking about it on and off, but I just want to give you guys some numbers and some information about maybe, getting some quality dental care as well.
All right. Well, that wraps it up for racial disparities.
Yes,
And
yes.
once again,
For
thank you
now.
guys for joining us. And always, always go onto our Instagram, our website, Truth Be Told Podcast .com. The link to the website is in our Instagram at Truth Be Told Podcast. So, you can, and then you can check out the YouTube, the Facebook. It's all there for you.
hmm
Many places to look us up.
Yep, absolutely.
Okay. All right. Well, that's another great episode. Plenty of great information, stuff that I learn. I learn every time, you guys. She's because
Good. I'm glad to hear
I'm not
that.
informed because she's the expert. So, all right.
Yeah.
Well, till next time.
All right, you guys take care.
All right. Bye.